Well, to talk a bit more about that fifth wave of COVID-19 here in France and what the government should do, I'm very pleased to be joined by Jan-Cedric Hansen. He's the Vice President of the Global Health Security Alliance. Good afternoon to you, sir.
Good afternoon.
Thank you for coming in. Before we come to the government's plans, first of all, France has one of the highest vaccination programs, not just in Europe, but anywhere in the world. Yet we are seeing this enormous rise in cases right now. Why?
Because, first of all, a vaccination doesn't protect you individually or doesn't prevent you from getting the disease individually. It's like a layer. A virus is like a cloud of mist that spread over a region. If you wear a raincoat, you will be protected by a cloud of dust, of mist. But if you take a shower of virus, then no matter your raincoat, you'll get wet and soaked. And you have to understand that the vaccine is just like a raincoat, no more. So it protects you in some way, but if the amount of virus that spreads or is in your environment is higher than the protection that you can get from the raincoat or from the vaccine, then you'll get infected.
I think
so it protects the population as a global herd, but it doesn't protect you necessarily individually.
Well, I think that's a really helpful metaphor that you give there. And I wonder if part of the reason why this raincoat, as you put it, is not as effective as it could be, is that the efficacy of the vaccine is waning. I mean, many people had their vaccine 6-7 months ago, and maybe they're just not working as well as they did then.
So it's not the efficacy of the vaccine itself there that is waning. It's the ability of your body to produce the antibodies that protects you.
Okay. And
the specificity of the COVID family, which has numerous members, among them the Covid-19, the SARS-CoV-2, they have a specificity that is they do not elicit a proper immune response in the human body. That's why we have cold every year, and several times a year we get a cold. It is made by the COVID, another kind of COVID, and you don't have immunity from that. So the beauty of the vaccines, of the RNA vaccines, it's that it forces the production of antibodies. But since it's not a natural way of producing them, there is a waning in your body, the ability to produce those antibodies.
All right, so let's look at perhaps what the government should do. We heard a little from the government spokesperson there talking about some of those plans that will be announced in full tomorrow. It sounds like what they want to do is get more people to have booster shots. Is that the best plan right now in your view?
That's part of the best plan, because it's, as I say, you need multi-layer protection in order to minimize the number of holes in which the mist of virus could sneak in and reach you. So social distanciation is among them. Washing hands is another one. Wearing a mask is another one. Getting a shot or a swab is another one. So it's relevant to do that.
OK, but social distancing, for example, I think many of us will have noticed that in the last few months, even though we have the COVID health pass here in France, that social distancing measures have become much more relaxed. People go to restaurants without keeping their masks on. Yet the government doesn't appear to want to do another lockdown and really restrict our behaviour. So is that the wrong call?
Well, the global lockdown has a huge drawback, is prevents you from having a side area that can back up or support you if you're locked down. So very restricted lockdowns in specific areas where you have massive circulation of the virus might be a solution. But the global one is against the will of the people in a certain way. And we are social animals in a certain way. So we need to interact. So the virus will use that fact that we need to interact. But we can minimize the risk if we take protections and support the layers. So there is no need for a lockdown necessarily, depending on the situation, but a need to reinforce avoidance of the vulnerability that will let the virus to invade us or contaminate us.
All right, really interesting stuff. Unfortunately, we're out of time, but thank you very much indeed, Jan-Cedric Hansen, talking to us there. Appreciate it.
Okay.